Getting a smartphone at a younger age could put children at higher risk of health complications. Here to answer your questions is Dr. Scott Hadland, Chief of Young Adult and Adolescent Medicine at Mass General Brigham for Children. Great to see you, Dr. Hadland.
Good to see you, too.
All right, Dr. Hadland, this comes from a new study that looked at 10,000 preteens who either did or did not have a smartphone. So what did it find?
Yeah, this was a study of preteens from all across the United States, and there were a few findings. The first thing the authors found is that in this research, the most common age that kids got a smartphone was at age 11, but a lot of kids actually got them at ages 9 or 10 as well. So really early age of first smartphone. But what the authors then looked to see is what were the health outcomes that these kids had. And in fact, kids who got a smartphone were more likely to have difficulties with depression, more likely to have difficulties with poor sleep, meaning they weren't getting enough sleep at night, and more likely to have issues with their weight, more likely to meet criteria for obesity. Then what the researchers did was they looked to see what happened with kids who had an even earlier onset of their first smartphone use, meaning they got it at a really young age. Well, with each decreasing year, sort of each younger year with which they got a smartphone, kids were even more likely to have these difficulties with poor sleep and obesity. So I think the message here is one that we pediatricians say all the time is that, you really want to do everything you can to put off that first smartphone.
Yeah, troubling for sure. Okay, but what if you feel like it's too late, right? Research has found roughly half of American kids now have a smartphone by the time they're 11. So what can parents do if they've already given their kid that access?
What we pediatricians do is we actually walk families through something that we call a family media plan. And if viewers are interested in this, you can Google American Academy of Pediatrics and look up these family media plans. They're an opportunity for you to sit down as parents and actually come up with a set of guidelines for your family. And it includes things like setting clear boundaries around use, making sure that young people aren't using smartphones at the dinner table or at dinner time, having certain parts of the house where they aren't going to use their smartphone, like in their bedroom or in the couple of hours leading up to bedtime. Talking parents through how to set up parental controls and monitoring of their internet and their child's smartphone use. Talking to teens and preteens about careful use online. What is appropriate information online versus what's mis or disinformation? What are some of the things that you need to be thinking about as a parent in terms of online safety? So there's a lot of really good stuff in here. And I guess the last thing I would say for parents is, and this is what I struggle with, and I've got 2 kids of my own, is trying to remember to monitor your own behavior, meaning we should be good role models of our cell phone use in front of our kids and try to put them down and interact with our kids when they're in the room.
So true. Good advice. Dr. Hadland, thanks very much for your time. We appreciate it.
Thank you, Dr. Hadland.